Hello, I'm Dr. Sanket Mehta. I am a surgical oncologist specializing in gastrointestinal and hepatobiliary cancers from SSO Cancer Center. If you or someone you care about has been told that cancer has spread to the liver, known as liver metastasis, you may be wondering what that really means and whether surgery is an option. In this video, I'll walk you through when liver surgery is considered in metastatic cancer and what the process typically looks like, so you can feel more informed and prepared. Liver metastases occur when cancer cells from another part of the body travel to the liver and begin growing there. This is different from primary liver cancer, which starts within the liver itself. The most common cancers that spread to the liver are colorectal cancer, neuroendocrine tumors, breast cancer, less commonly considered for surgery, pancreatic and gastric cancers, in very select cases. Liver is a common site of spread because it filters blood from many abdominal organs, allowing cancer cells to lodge and grow there. Not all metastases can be or should be operated on. Surgery is considered when the cancer is limited to the liver or mostly in the liver. All visible disease can be safely removed and the remaining liver has to be healthy enough to regenerate. There should also be no uncontrolled cancer anywhere else in the body, and the patient must be medically fit for surgery. And most importantly, the organ of origin and tumor biology should suggest that the surgery will have meaningful outcomes. For example, in colorectal cancer and neuroendocrine tumors, surgery can offer excellent survival benefit because these cancers are either slower growing or highly responsive to systemic therapy. In contrast, for pancreatic cancer, biliary and gastric cancers, we are much more selective, as these cancers tend to be more aggressive and harder to control even with combination treatments. In some of these cases, surgery may offer little long-term benefit or it may even be completely futile. So, the type of cancer plays an equally important role in deciding whether surgery is appropriate for a particular patient. The surgery is called as hepatectomy or liver resection. It involves removing part of the liver where the metastatic tumors are located. This can be wedge resections for smaller lesions, segmental or lobar resection where we remove either a segment or a lobe of the liver or a combination of the above to completely rid the liver of the disease. And multiple resections can be performed for various lesions at various sites. The liver's regenerative ability allows it to grow back over time, which is why even large portions can often be removed safely by experienced hands. Surgery may be done via open technique, which involves a traditional incision, or minimally invasive techniques like laparoscopy and robotics, depending on the tumor size, location, and complexity. We will cover detailed surgical techniques like intraoperative ultrasound, vascular resections, and parenchyma sparing surgery in a separate dedicated video, as this is a complex topic on its own. After liver surgery, most patients spend 5 to 10 days in the hospital. Recovery at home usually takes 4 to 6 weeks with gradual return to eating, physical activity, overall strength and well-being. Potential risks include bleeding, infection, biliary leakage, and delayed liver function recovery, especially in patients with pre-existing liver disease. These risks are generally well managed in experienced centers with proper preoperative planning and a multidisciplinary postoperative care approach. Does liver surgery improve survival? Yes, absolutely, in selected cases. Especially in colorectal liver metastasis, surgery can significantly extend life, improve quality of life, sometimes even achieve long-term remission and cure. In fact, 5-year survival after complete liver resection for colorectal liver metastasis can reach 40 to 60%, depending on tumor biology, timing of surgery, and how early it is performed. For other cancers, outcomes vary, and surgery is often combined with chemotherapy, targeted therapy, and ablative techniques for smaller or inoperable lesions. Now, a very important perspective to leave you with. Even before the modern era of chemotherapy, in the pre-1999 era, Japanese surgeons were performing liver resections for colorectal liver metastasis. Even without systemic therapy, they achieved 5, 10, and even 15-year survivals purely with surgery, which is why surgery remains the cornerstone for treatment of colorectal liver metastasis, and no systemic therapy can replace its potential for cure. Today, we are fortunate to have both surgery and modern therapies, and the best outcomes happen when they are used together in the right patients. So if you or a loved one is navigating a diagnosis of liver metastasis, please remember, surgery is not off the table just because it's stage 4, and surgery, when appropriate, can be one of the most effective tools in cancer management. If this video helped clarify things for you, feel free to like, share, or subscribe so that more patients and families can benefit. Thank you for watching. I'm Dr. Sanket Mehta from SSO Cancer Center.